I will now talk about the core public functions and the 10 essential services as they relate with correctional nurses. Now, correctional nurses are challenged to provide maximum health care in a setting with a mission and design for the purposes of security and public safety, and for this reason, resources can be limited and creativity is needed. The core function of assessment includes the essential services of monitor health, diagnose, and investigate. Now, how does this relate to correctional nursing? Correctional nurses must be knowledgeable and competent to complete various screening processes. This means that they must know the purpose, focus of data collected, and the time frame for screening to take place. Reasons for screening include the following: admission, work clearance, assessment for segregation, referral to alcohol or drug treatment, transfer to another facility or to court, and after a use of force incident. Nurses must be able to screen inmates for a broad range of things, including need for urgent dental or mental health care and preventative care. Nurses use professional judgment to determine the disposition of each inmate screened. Now, the nurses have a responsibility to communicate the findings and conclusion of screenings. The next core function is policy development, and the essential services are inform, educate, and empower, mobilize community partnership, and develop policies, which means that we are being part of the solution. The relationship to correctional nursing is one area that has been found to be important in providing health information to inmates. Handouts should be made available for inmates suffering from chronic illnesses such as diabetes, explaining to inmates what the health services there can provide for them, providing advice as to how the inmates can best cope with such illnesses while in prison, and if these handouts are not effective due to language barriers or poor literacy, alternative ways of sharing information should be used. Alternatives are videos and other visual aids or health discussion groups with a trained health worker. Regular contact with local community services and the involvement of voluntary agencies can assist significantly in promoting health and well-being in prisoners. Inmates should be connected to key community services before leaving prison, such as probation and parole and social services. Services that may be needed by these individuals include advice on preventing communicable diseases, including advice on avoiding sexually transmitted diseases, HIV infection and hepatitis B immunization, advice on high-risk lifestyles such as drug overdose once leaving prison or jail, and protection against harm caused by smoking, advice on health behavior such as appropriate levels of physical activity and a balanced diet, and ways to promote mental health, including adequate time for association and starting a meaningful occupation such as work, education, artistic activity, and physical education, and staying in contact with the outside world such as family. The final core function, assurance, and the essential services enforce laws, link to services, assure a competent workforce, evaluate and research. This is making sure that what needed to be done is done. The key components of a prison health service are contained in a section of the Standard Minimum Rules for the Treatment of Prisoners, produced by the World Health Organization and the Office of the United Nations High Commissioner for Human Rights. Prison health care services must be able to deal with the following 4 priority areas: primary care, mental health, infection, such as tuberculosis, bloodborne viruses including HIV and skin conditions, and dependence to drug and alcohol. Now, how can we assure a competent environmental health workforce? Well, the ability to measure performance depends on the resources distributed to prison health care and on the prison's capacity for recording information and for having achievable and recognized standards for good practice. Performance depends on acceptable facilities and processes that allow inmates easily access to health facilities. This matter is also dependent on security staff being able to escort inmates and to provide safety and assurance for healthcare staff. In balance, facilities should allow for protection of confidentiality and privacy, with assessment and diagnostic facilities that match the skill and capacity of the public health service. Facilities should be adequate to deliver care, including of sufficient size, clean, with natural light, good access for people with disabilities, and with meetings, reference, and administrative facilities.